My name is Christopher Wells. My pronouns are he, him. I'm speaking with you today from Treaty 6 territory in Edmonton. An interesting fact is that our city council recently gave all of our electoral wards Indigenous names. And so we have an election coming up in a couple of weeks here in Alberta at the municipal level. And it's been a great opportunity to provide education to everyone around the meaning and the significance of those names and how they were achieved and given through ceremony with our Indigenous peoples in Edmonton. As a broad overview today, and to situate some of our thinking and conversation, I'm going to start by highlighting 8 actions or strategies that municipalities can engage in to promote safety, community safety, and promote inclusion for LGBTQ2 people across the lifespan. And when I refer to LGBTQ2, I'm using the federal government's terminology, the initialism that they use, and that refers to lesbian, gay, bisexual, trans, queer, and two-spirit. I think increasingly in Canada, you see more and more organizations use 2S LGBTQ plus as part of the process of understanding reconciliation and decolonization efforts, to put the 2S in front. But that's something we can talk about. The rainbow initialism, the rainbow community will be our focus today. So I'm going to start by trying to share my screen and move forward here, if all goes well. All right, I think you might be able to see that. Perfect. All right. What I'll do is provide this introduction, then we're going to hear from our panelists about some of the work that they're currently engaged in to better understand and support the unique considerations of LGBTQ people in Canada. In particular, we thought it would be important to focus on some of the experiences of LGBTQ youth and older adults, both who often experience vulnerability at different ends of the life cycle. I think more and more we're becoming familiar with some of the challenges of LGBTQ youth, but often we, I think, forget to think about seniors, LGBTQ seniors in our community. In particular as well, we've seen some new research that has emerged in relation to the COVID pandemic when it comes to some of the challenges of accessing services, mental health, depression, and suicidality with LGBTQ2. We often are now becoming more and more aware that some of our vulnerable or marginalized communities have become more vulnerable during this recent pandemic. All right, I'm just going to move us forward here. So I've sort of conceptualized some of these actions around what I call buckets, 8 sort of different buckets of different actions that municipalities can take to move forward inclusion and equity for LGBTQ2 people. So the session is called Moving Beyond Pride Flags and Rainbow Crosswalks. We know that visibility is a very important first step, and it matters a lot in our communities. We've seen communities across Canada raise pride flags, issue pride proclamations, and paint rainbow crosswalks in their communities as excellent ways to demonstrate inclusion and support. Sadly, we've also seen vandalism occur when pride flags have gone up. They've been ripped down, they've been burned, and crosswalks vandalized. But I think we've also seen some amazing community reactions when that has happened as well. In fact, it has symbolized maybe still the work that we have to do within our communities. But we would start with the premise that these are important first steps, but they shouldn't be the only or the last steps. They need to be followed up with everyday actions, and particularly actions that begin to address systemic discrimination, something we're perhaps finally talking more and more about publicly in Canada. I think about some conversations with the RCMP over the last year or so when it comes to the word systemic discrimination. inequity, and also promoting full inclusion in all aspects of community life. We know that these visible signs and symbols are often indicate a strong commitment to create a more welcoming, respectful, and inclusive community. The question becomes, what's next? How do we move beyond symbols into systemic kind of change? This is not necessarily the beginning of this is the beginning, not the end of a journey. Culture, we know, doesn't change on its own. It's important for us to be proactive, not just reactive, when it comes to supporting issues of diversity and inclusion. The old mantra is that the status quo doesn't change on its own. It really takes that leadership and commitment for us to be able to move forward. So one of the ways that we've seen many municipalities begin to move forward into addressing some of these more systemic issues is to take action to prohibit conversion therapy. And you see me put, and many others put conversion therapy in those scare quotes or those quotation marks, really to emphasize that it's not therapy at all. In fact, it's best been described as a form of psychological torture. We know that more than a dozen municipalities now have passed bylaws or policies to prohibit the practice and promotion of this so-called conversion therapy, which disproportionately targets youth and young adults and can lead to a lifetime of internalized homo, trans, biphobia, shame, stigma, and even increase the risk of suicide. Conversion therapy practices, as they're defined, include any attempts to change, suppress, or deny a person's sexual orientation, gender identity, or gender expression. I think it's really important for us to know and realize that all conversion therapy practices stem from an anti-LGBTQ2 ideology. If you don't believe that there's inherently something wrong with LGBTQ2 people, then there's no need to try to fix them or change them, but rather just to accept them within your communities. Unfortunately, we know that this is still happening in many of our communities. Some of the latest Canadian research estimates that more than 50,000 individuals have been subjected to conversion therapy practices in Canada. This is an ongoing and a pressing concern. And what we do know is that municipalities have an important role to play when it comes to limiting known harms and abuses. So passing something like a conversion therapy prohibition bylaw is well within the scope and authority of municipal powers. In fact, municipal legislation passed to date has actually been stronger than most provincial and even proposed federal legislation, such as the discussions we've seen on Bill C6 and then reintroduced as Bill C8. And we're expecting that the next federal government, Liberal government, will deliver on its platform promise and introduce legislation yet again to criminalize conversion therapy in Canada. We often maybe like to say third time's the charm, that all parties will agree to move this forward as a priority piece of legislation. The takeaway here is that we don't actually need to wait for the federal government to act. A conversion therapy prohibition bylaw not only serves as an effective deterrent, but also makes a powerful statement about the kind of community that you want to create. The third item, or the third bucket, is related. It's about the importance of addressing street harassment, bullying, and hate within our communities. We know that LGBTQ Canadians are continually one of the three most targeted groups for police-reported hate crimes in Canada. And of all the hate crimes committed, they're often, tragically, the most violent in nature. We're not talking about one stab wound, but often 40 stab wounds, which really gets at the process of dehumanization, where LGBTQ people are not even seen as persons, but as objects to be destroyed. And in Canada, the top three most targeted groups for hate crimes have historically been the Black community. You can see the impacts there of racism, the Jewish community, the impacts of anti-Semitism, and the LGBTQ2 community, the impacts of homophobia, biphobia, and transphobia. We know some research that you'll hear about later this presentation from Dr. Sawick on trans and non-binary youth indicates that many public spaces are not safe, including public bathrooms, transit, and even some neighborhoods or areas of neighborhoods. Many trans and non-binary youth have identified these as places they simply don't go, or they don't go alone, or make a deliberate effort to avoid. The City of Edmonton and soon the City of Calgary have passed new amendments to what's been called their Public Places bylaw, which now allow for fines and municipal enforcements for acts of public street harassment, sexual harassment, hate symbols and signs, and misogyny. These become really important tools in creating safe, welcoming, and respectful communities for everyone. As an example, in Edmonton, every Friday night on White Avenue, one of our main intersections and cultural destinations in Edmonton, there are street corner preachers and often preaching anti-LGBTQ rhetoric. And so some members of the LGBT community over many months have simply started to show up on Friday nights and play music and hold signs on the same street corner to send that message, as they say, particularly to LGBTQ young people, that you are loved, and that they're taking a completely lawful and community-based approach to get another message out there, a message of support, a message of welcoming and inclusion within their community. And this has become a Friday night ritual where people just show up, and for a couple of hours, they have an informal street party on White Avenue in their community. Number 4, you might wonder, what does follow the money mean? This is about ensuring for funding for LGBT community organizations, especially those who are supporting youth and older adults. I like to use the phrase with people who are responsible for budgets, something that Martin Luther King Jr. once famously said. He said, budgets are moral documents, meaning that you can tell what gets valued the most by where the funding goes. And so I think this is a very interesting exercise for us to follow the money in our community. Ask how much of your city, or in Alberta, we call it family community supports and services funding, an envelope of funding that's given to municipalities. How much is dedicated to services and programs that support community integration and inclusion and support specific LGBTQ2 initiatives. Research tells us that LGBT youth and older adults are vulnerable at both ends of the life cycle. How are they included in your city and community programs and services? Examples might include mental health, suicide prevention, homelessness, senior supports, assisted living facilities, domestic and intimate partner violence initiatives, amongst others. Does your city funding require recipients have non-discrimination statements and policies? Equitable practices that do not discriminate against LGBTQ people. These are all requirements of funding that municipalities can put in place. As an example, some municipalities have passed corporate policies that prohibit the use of city resources, funding, facilities, or advertising to organizations or groups that practice or promote conversion therapy. These are specific policies that are in place alongside municipal bylaws. So another question might be, is funding or a stream of funding dedicated to help support local pride celebrations and events as important cultural, community building events in your community? Now, number 5 is about counting us in. This is about including LGBTQ people in your local census and surveys. This is a reminder that representation matters. This can be a simple and effective way to start normalizing the conversation about the diversity of gender and sexuality. It also helps to build understanding about the difference between sex and gender, and how gender is best seen on a spectrum, not on a binary of simply male and female. A simple step is to move away from these kind of binary options, like including only male or female in your surveys. these sort of small recognitions are important. As an example, the next Canadian census from the federal government will finally include more inclusive questions around sex and gender. You can model your own municipal surveys on the census, which would also allow for a more direct comparison of data to come. We often say, don't be afraid to ask inclusive questions. As some of the youth like to remind us that the future is non-binary. And so how are we going to be prepared for that non-binary future? Which takes us to point number 6 about the importance of building inclusive facilities and washrooms. To include universal multi-stall facilities in all new buildings, and to look for opportunities to renovate existing washrooms and change rooms to be more inclusive. It's really important to note that this increases safety for many different users, not just members of the LGBT community. Many people, for a variety of reasons, often feel unsafe in public washrooms and facilities. This also makes a strong signal of inclusion within your communities. The challenge for us is, how do we make this the standard as we move forward, not an option or an afterthought? And I think part of the larger term solution is for us to advocate for changes to provincial building codes to make this mandatory, particularly of all new facilities that are built, to have these kind of universal washrooms. I think we can think back a time ago, for example, when we were thinking about accessibility ramps, the position of light switches and handles to ensure more full inclusion in the kinds of facilities that we're building. Another example is to ensure your community recreation and fitness facilities and swimming pools are inclusive. We've seen some communities that host an all-gender, all-bodies swim night as a way to ensure through training and about creating the safety of an environment and not denying people the opportunity to participate and enjoy public services and facilities in their community. We know what the research tells us is that sports and recreation can still often be hostile or discriminatory spaces for many LGBTQ people. Point 7 is about engaging your community. One way to do that is to create a community LGBTQ2 advisory committee, remembering that the LGBTQ2 community is not homogenous. In fact, we often say that the LGBT community is unique because it belongs in every other community, every other faith, every other culture in the world. And so it's really important for us to pay attention to issues like intersectionality, internal diversity, and that we're listening to a variety of lived experience. Another example of work that is occurring in some communities is around engaging your local police service to build bridges and relationships with the local LGBTQ2 community. An important part of this is acknowledging some of the harms of the past. And we've seen this increasingly as police services have been issuing direct apologies to their LGBTQ2 communities. As an example, in Alberta, we believe that the largest mass arrest in Alberta's history happened 40 years ago when they raided the Pisces Health Spa, which was a gay bisexual bathhouse in Edmonton, and where the police, after several months of undercover operations, arrested over 60 men and put them in paddy wagons and marched them to a special hearing without legal counsel at 5 a.m. in the morning. And these are instances that many in the community still remember. And so we often are having conversations about, should police be involved in pride parades, in uniform, not in uniform, or participate at all. These are some of the hot button issues happening across our country. But we also have to remember that LGBTQ2 people are members of the police service as well, and are trying to bring a representation and diversity and voice within their own organizations too. So there aren't necessarily easy answers in some of these issues. Item 8, the last bucket, And this is about engaging and modeling inclusive practices. So here we really remind folks that language matters. You can review your workplace forms and your websites and your communication for inclusive language. These kind of small actions can speak loudly. We've already heard about the importance of using and including pronouns in communications, on name tags, email signatures, and about avoiding gendered assumptions, little ways that we might be able to challenge binary thinking. There's an opportunity, or is there an opportunity, to provide ongoing professional development on LGBTQ issues and trends for city staff? Can we build on our strengths that already exist in our community? Many community libraries are doing great work and are frequently identified as some of the safest and most inclusive spaces within communities. Particularly some of the work that we've done with LGBTQ2 youth identifies libraries as those safe and supportive places. Are you hiring for diversity? Ensuring your city staff reflects the diversity of your local community. And a question there is to ask how many of your staff are openly LGBTQ2. You can support employee diversity and resource groups. In fact, many of these Fortune 500 companies are now all creating LGBTQ2 employee resource groups. And part of the thinking is there that your employees know your culture the best, and bringing them together can help to move your culture forward. But this takes leadership, and it also needs to ensure that the leadership is actioning what these resource groups are telling them, and that they feel included in part of trying to shift and change the culture. Is your municipality providing dedicated supports for trans and non-binary employees? Does your municipality have clear policies and supports for transitioning employees? There are many best practice examples that are now in place. And in fact, not only are these good things to have, in many cases, these are clear human rights requirements, with the expectation that organizations, which are publicly funded, will be not simply reactive and wait for employees to come out and then develop policies and supports, but are proactive, that actually have these supports in place ahead of time. And then lastly, one particular strategy might be to develop a community LGBTQ2 action plan, a plan that is built with your community, that sets measurable goals and targets, and this will mean provides a means for community engagement and accountability. In fact, the federal government has committed to build an LGBTQ2 national action plan. So we're going to be waiting to see what that looks like, but I think we can start this work in our municipalities. It's often been said that municipal governments are the government that is closest to the people and can have the most impact on the direct lives of people. So I'm going to stop there and stop sharing my screen, and we're going to be able to park any questions you have in the comment box, and I'm going to shift it over to our first panelist, Dr. Elizabeth Saywick. I will say that I have had the great pleasure to work with Elizabeth we were trying to count recently how many years. And I also want to give a shout out to Elizabeth and the Cerevic team that is this year celebrating their 15th anniversary as a group that has been dedicated to working on many of these issues in our community, and specifically about bringing the importance to bear of research into knowledge mobilization and the kind of social change that we're talking about. So without further ado, I'll say take it away, Elizabeth.
Thanks, Chris. And welcome, everyone. Thank you for having me as part of this conference. I'm coming from the ancestral unceded traditional territories of the Musqueam people, who are part of the Coast Salish people in Vancouver. I'm going to talk primarily about youth because that is the research, although recognizing that youth can include people up to age 30 and young adults up to age 44, but most of the work that I'm going to be talking about today is the 25 and under crowd, and especially students in school. So just a reminder to everyone, prohibiting discrimination on the basis of sexual orientation was actually added to the Canadian Human Rights Act in 1996, and gender identity and expression were added 21 years later to that same Human Rights Act. And most of the provinces also have these same protected grounds in terms of preventing discrimination. And so it's important for us to be thinking about, as Chris had already said, this isn't necessarily just a good thing to do, but it is actually promoting human rights that we're obligated to under law. So I'm going to focus on the 2SLGBTQ plus youth, and specifically talking about the experiences of discrimination, stigma, violence in Canada, both in national and provincial BC research. I'm also going to focus on a particular topic around IDs that are a particular challenge for inclusion for trans and non-binary young people. A bit about why rainbow symbols are important but not sufficient that we've had in terms of some of our qualitative work with young people. And then I'll finish up with the results of a study that focused on what contributes to 2SLGBTQ plus well-being for young people in communities, large and small, across BC. So first, I need to talk a bit about our data sources. The first is the Canadian Trans and Non-Binary Youth Health Survey in 2019. There's also a little bit of data from the first one that we launched in 2014. And I should mention that both Dr. Gehagen and Dr. Wells were part of the team that is involved in implementing this survey. This is an online survey of health and risk exposures, and this is for young people aged 14 to 25 in English and in French. And it was conducted between November 2018 and May 2019, and included more than 1,500 trans and non-binary young people as part of that study. They represented young people from all across Canada, including in the territories, with, of course, larger groups in some of the larger, more populated provinces. But, you know, even PEI had 12 people who participated in the survey. I'll also talk about results from the BC Adolescent Health Surveys of 2013 and 18. These are province-wide school-based surveys of students in grades 7 through 12, so that's 12 to 18-year-olds, and they include between 30,000 and 38,000 youth across the province in every one of the school districts across the time period. They're conducted every 5 years since the 1992-93 school year by the McCreary Center Society, and our center, Saravik, has had the ability to access those data as part of funding by the Canadian Institutes of Health Research over the past 15 years. Questions about sexual orientation were actually on the very first survey back in 1992-93 and have continued, although switching because we've added new terms like pansexual to the experience in terms of the questions. But in 2018, we actually followed Stats Canada's recommendations, included 2-question measure of gender identity so that we could actually tap into the experiences of trans and non-binary young people. So the 2 questions that are combined include your gender assigned at birth, even if you're not that gender today, and your current gender identity that actually included options of folks not identifying as girls or boys, but non-binary, and questioning their current gender identity. And this allowed us to create categories of cisgender girls and boys, transgender girls and boys, non-binary youth, and questioning younger people. So just a quick look at the percentages in the BC Adolescent Health Survey. We see 2.5% of young people identify as gender diverse, whether we're talking about smaller percents of trans girls and trans boys or non-binary youth, and a fairly large number who are questioning their gender. And in all, this actually ends up being around 1,000 young people in the survey, which represent an estimated 6,300 in mainstream schools across BC. As well, when it comes to sexual minority youth in 2018, 16% of young people identified as some flavor of sexual minority, whether that was the 5% mostly straight, the 6% bisexual and pansexual, 1% gay or lesbian, and 4% who are questioning their sexual orientation. And it's important to recognize that this looks a little different by gender. So nearly 8 out of 10 non-binary young people identified as gender or sexual minority in addition to gender minority, whereas only 1 in 10 boys and 2 in 10 girls. Now, I should note that in this, the girls and the boys include trans girls and trans boys. So let's first talk about the experiences of discrimination, violence, and safety. There are places that young people avoid, and this is data we have from the Canadian Trans Youth Health Survey. Malls and clothing stores, locker rooms, gyms or pools, and public washrooms, as well as school washrooms, are the most common places. And by far, public washrooms and gyms and pools are clear places where people are avoiding them when they're trans and non-binary. We also see that more than 3/4 of trans and non-binary young people reported that they've experienced some SOGI-based or sexual orientation or gender identity-related verbal harassment in the past year. And this has actually increased in 2019 compared to 2014. When we look at the BC Adolescent Health Survey, the school-based survey, as you can see, compared to cisgender boys, all the other groups, including cis girls, experienced some kind of bullying, whether that was verbal bullying or social exclusion or actual physical assault. And so they have disproportionately higher rates of bullying compared to cisgender boys. However, we also have the ability, because we've asked about sexual orientation since the very beginning, to actually go back and look at trends. And if we look at just past year trends in violence among lesbian, gay, and bisexual youth, can't look at gender diverse youth because we just asked that question in the most recent survey, that while LGBT youth in 2018 were still more likely than their straight peers to report verbal harassment, social exclusion, and physical assault, there is good news. The gap between LGBT youth and straight youth has actually been getting narrower over the 10 years since 2008. And this is due in part to major declines in the number of lesbian, gay, and bisexual teens who actually report that they've experienced bullying, social exclusion, or physical assault, especially declines in physical assault. But it also is due to increases in verbal harassment that straight youth are reporting. When it comes to discrimination, we ask about whether or not in the past year you've experienced discrimination because of a variety of different aspects of you, including your gender, your sexual orientation, or because people think you're gay or lesbian or bisexual, your weight, your appearance, disability, family income, and because of your race or ethnicity. And gender diverse youth were more likely to report discrimination than cisgender students for every type of discrimination except racial discrimination, where 1 in 10 youth of all gender identities reported racial discrimination in the past year. When it comes to school safety, only about 1 in 3 gender diverse youth felt part of their school and happy to be at school. Most of them usually felt safe in the library or the classroom. And in fact, both gender diverse youth and LGBT youth have consistently rated libraries as the safest place they have in the school area and in public settings. And very few felt safe in washrooms or in changing rooms. When it comes to community questions, also on the BC Adolescent Health Survey, 2SLGBTQ+ students were less likely than their cisgender or straight peers to report feeling safe often or always on public transit, in their neighborhood during the day, and in their neighborhood at night. So why does this matter? The research has consistently linked violence, including bullying, abuse, and harassment, to suicide thoughts and attempts among young people of any sort, but also specifically to SLGBTQ+ youth. And what we found over the years in the research we've done is that youth who feel safe in school and in their communities and have supports, including their family support and support by others in the community, are far less likely to report suicide attempts in the past year than their straight or cisgender peers. So let me switch gears and talk about the importance of gender congruent identification for gender diverse young people? We asked this question in 2019, and we found that the majority of young people said that the wrong gender is listed on their passports or their foreign passports, their driver's license, their healthcare card, their birth certificate, their school records, student ID, medical records, etc. The reasons they gave, a lot of people plan to change but haven't done that yet. Nearly 40% actually are worried that changing their gender on their IDs actually would put them at risk for harm or discrimination. For non-binary young people, the gender options that are available don't fit their gender. Some people can't afford it, especially the complex processes that go into changing your IDs. Some are not allowed to change the gender because of the requirements for gender changes on documents. Sometimes they do require medical transition in some jurisdictions, and fully 1 in 3 don't know how to do it, even though they want to. The reason why gender ID is such an important issue is that when gender identifications match their gender identity and expression, they're treated better, they feel safer, and they're more likely to report good or mental health and better general health. And in fact, the more IDs they have that correctly identify their gender, the better their health in terms of their self-reported health. While municipalities generally don't have the direct responsibility for the decisions around how IDs happen, so many of the services that municipalities provide or work with actually do involve identification of one sort or another. And so the importance of supporting and advocating for gender congruent IDs and the ability for people to change their identification easily and accessibly is an important contribution that municipalities can make, as well as ensuring that their staff and the community organizations they work with actually understand best practices around working with IDs and working with young people whose identification may not match their gender identity and expression. So I know the title of this was about beyond rainbows and pride flags and rainbow sidewalks, but I did want to point out some of the research that we've done in relation to rainbow symbols and pride flags and rainbow sidewalks. Qualitative research we've conducted across British Columbia that talked with young people, they identified how much they actually look at and notice pride symbols and safe space symbols and rainbow signs as a signal that people get it in those schools, in those community services, in Park and Rec, and the various places. And so they do look for it and appreciate it when it's there. However, over and over again, they said it can't be just symbolic, it can't be just lip service. It has to be backed up by training and concrete actions to demonstrate that they're not just rainbow washing, but actually meaningful symbols of the safety and inclusion in the community. And in relation to that, I'd like to share one of the studies that we've been involved with over a number of years. This was a study called Project Respect, which was related to understanding resilience and educational experiences for queer and trans young people, both in British Columbia, in Minnesota, and in Massachusetts in the US. And this was a study that was funded by the National Institutes of Health. The study involved first go-along interviews in cities and rural areas across BC, where we actually interviewed 2SLGBTQ plus youth in community settings, and they basically walked us around and identified where they feel safe, where they would take a friend if they had like a queer or trans friend coming to visit them, where would they show them in their town and why? And what were sort of the elements of safe spaces and inclusive spaces in their particular community. We then used that information to create an inventory of supportive environments. And this actually involved us doing this massive Google surveys and visible surveys of communities all across BC, large and small, wherever there were students who participated in the BC Adolescent Health Survey. So that included places like Salmon Arm, as well as, of course, largest places like Victoria. And we looked at the extent to which they had data about things like whether or not there were GSAs in the schools, whether the schools had anti-homophobic bullying policies or specifically inclusion policies in their schools, and then whether or not the community had youth serving organizations that it specifically mentioned that they were welcoming and supportive for LGBTQ youth, whether there were youth serving organizations that actually provided like community centers and such that specifically had events, community resources such as PFLAG and other kinds of supports, including clinics, and then community events such as Pride or the Trans Day of Remembrance. And these were mapped all across BC, along with mapping additional data from the government related to progressive political environments around laws and voting, as well as the size of the municipality, et cetera, to make sure that we were sort of controlling for the variety of possibilities and being able to speak to some of the smallest towns as well as some of the largest metropolitan centers. What we found is that when you control for school factors like safe and inclusive schools, we actually found that young people also had lower risks of suicide thoughts and attempts when they had higher levels of community LGBTQ supportiveness in terms of the services and resources and progressive political environments. We also found that when it comes to substance use and problem substance use, LGBTQ youth had lower levels in communities that had higher levels of supportive resources. Now, most of these findings were significant for girls more than for LGBT boys, and we didn't have the ability to map this onto trans and non-binary youth because they weren't part of the survey until that we knew of until 2018. So we'll have to wait to be able to look at that work. But essentially, what this tells us is that communities can do a lot to help 2S LGBTQ plus young people feel safe and included. And that makes a difference because it contributes to their health and well-being. Last, if you're interested in many more details about the experiences of young people, we have both the BC Gender Diverse report, but also the national Being Safe, Being Me report for trans and non-binary youth from the CTYHS. Thank you.
Thank you, Dr. Sawick. And I would add, people might be interested in the national report. There are fact sheets with provincial and territorial breakdowns too, so you can see what's happening in your neck of the woods, so to speak, and be able to use that research to advocate for some of the changes that we've been talking about. So next, we're going to turn it over to our second panelist, Dr. Gehagen, who is going to talk about the other end of the life spectrum, dealing with LGBTQ2 older adults.
Great. Thanks very much, Chris. Bonjour tout le monde. My name is Jackie Gehagen. My pronouns are they, them, and I'm really pleased to be here with you today to talk a little bit about housing as a key determinant of health for older lesbian, gay, bisexual, and trans Canadians. And I just wanted to note that I'm not using Q in my presentation, although there's conversation here about the need to be as inclusive as possible in the acronyms that we use. It's important to note that when we're talking about this generation of LGBT Canadians, many of whom would have been born between 1946 and 1965, the term queer was considered a pejorative or negative term, and other concepts that we currently use in our efforts to be more inclusive generally were not part of the popular vernacular at the time. So I'm specifically making that disclaimer now so people don't feel that there are many different letters of the alphabet coming to you, but rather to understand that these are contextually and historically embedded concepts. Okay, so really what I want to hammer home in this short presentation is the fact that We have a diverse population in Canada. We have lots of moving parts, and I'm going to focus just for the purposes of illustration on where I'm currently located, which is in Halifax, Nova Scotia, which, as you may know, is located on the unceded, unsurrendered territory of the Mi'kmaq. And so we know that Halifax Regional Municipality is the 14th largest municipality in Canada and has a population of roughly 450,000, although there's lots of interesting conflicting data out there determining things such as size of municipalities, expenditure, etc. So I'm going to go with what the consensus was on my online searches. It's also really interesting to note that Halifax Regional Municipality, or HRM, has the largest population east of Quebec City, and we're one of the fastest growing areas of Canada. And this population growth has primarily been driven by what our Mayor Savage calls the immigrant-driven effect, which is to say it's not people from Canada moving here necessarily, but it's people from other countries coming to Nova Scotia, which I think is in part driven by the fact that we have 7 post-secondary institutions in our province, which has a population of less than 1 million, which is pretty incredible when you think about it. So 10 years ago, major concerns in Nova Scotia were focused on aging and the shrinking population and what impact that would have on things such as healthcare, housing, etc. And yet, despite this, we still see that Nova Scotia faces some of the highest national rates of poverty and poor health outcomes. Just to give you a little bit more of context about Halifax, municipality, the average house price is about $440,000, quite a difference from where Elizabeth is in British Columbia. And the average cost of living is roughly $1,200, and that's without the cost of rent. The average household income in Halifax after taxes is just under $60,000. And prior to the pandemic, and again, this is data, government data that's sourced from the internet, LGBTQ2 plus Canadians, 27%, were twice as likely to have issues around housing, security, precarity, and homelessness. And according to the 2018 survey on public safety in public and private spaces, we know that LGBTQ Canadians, as both Elizabeth and Chris have noted, have more instances of reported violence, and sadly, in many instances, violence goes unreported. This is really important when we think of rates of hate crimes and how that makes for safe, welcoming places for our communities to live, particularly as they age and may be in need of particular types of congregate living situations where they might, for example, be living in a long-term care facility with individuals who grew up at a time where LGBT was not the norm, and in fact there were limited human rights legislation to protect the rights, and now they might find themselves in the same long-term care facility with individuals who fundamentally don't agree with their sexuality or gender identity or gender expression. So what's interesting about this graph, this is homicide rate by province. And so it kind of gives you a bit of a snapshot, if you will, across the country. And you can see in Nova Scotia from 1990 to 2020, the ebb and flow of homicide rates relative to the rest of Canada. You know, when we have had, sadly, some instances of fairly significant violence in the form of homicide, which may be impacting the rates that we see here. But this is also an interesting predictor for where people might want to live. In other words, you know, which province or which municipality do people want to live in for a sense of safety? And this is particularly important for older LGBT Canadians, many of whom, for example, have moved from other provinces to retire here. And so this is a really important source of income for municipalities, and it's also a really important point for Nova Scotia governments at all levels to consider how we actually represent ourselves relative to the rest of Canada in terms of providing a safe and welcoming environment, particularly for older LGBT folks. So I just wanted to share this with you. which is coming out of the National Housing Strategy. So as you know, the emphasis of the National Housing Strategy is twofold. One, to reduce the high level and inaffordability of housing in Canada, and also to reduce homelessness. And in the context of Nova Scotia, they're kind of glomming on to the National Housing Strategy statement, which is basically every Canadian deserves a safe, affordable place to call home, which is, they've sort of cribbed that off of the National Housing Strategy. And so we see that the government of Nova Scotia is investing $88 million to ensure people have a more affordable place to live. So that's great. The province is also investing $70 million in provincial priorities, supporting more than 2,500 households. And there's a 3-year action plan under the Canada-Nova Scotia National Housing Agreement, actually to look at long-term commitment in ensuring vulnerable citizens and others have a safe place to live. Now, what's interesting in all of this language, and this speaks to both a point that Chris made as well as Elizabeth, that we have these sweeping statements, these sort of feel-good statements, but when you try and unpack these action plans, nowhere in them, largely, do you find an articulation of what it means for LGBT populations. And I think this is something that needs to be further addressed. So having affordable housing plans and programs are incredibly important, including for Native housing units. And we see that Nova Scotia has paid attention to that file, in particular regions of the province. But when we look at this in relation to the broader National Housing Strategy, it's also important to note that in that document, there's only a passing reference to the unique needs of LGBTQ2S populations across Canada, no specificity in terms of what those unique issues are. And in fact, the National Housing Strategy notes the lack of nationally collected data on the issues facing LGBT populations across the life course. So we know that the Canadian Mortgage and Housing Corporation has worked in partnership with the Social Sciences and Humanities Research Council to sort of look at these issues and to develop relevant policy responses, noting this longstanding data gap. So this kind of begs the question, how user-friendly is Canada for LGBTQ2S populations? So I would argue that despite advancing LGBT human rights legislation and law, we need to recognize a long history of systematic discrimination against LGBT Canadians, so same-sex sexual activity for consenting adults, as Elizabeth has already pointed out, that was criminalized until 1969. It's also important to note that the baby boomer generation, this decriminalizing same-sex acts was an important watershed, but it didn't end violence and discrimination. This is incredibly important. So when people say 1969, everything was turned around in terms of the rights of LGBT Canadians, I would argue that's not the case. So other protections, as Elizabeth has also noted, were not in place for many, many decades following this, including same-sex marriage, which, as you know, was a bit of a patchwork across Canada, with some provinces adopting it at earlier dates than others. And there are a variety of existing policy knowledge gaps that have important implications for the housing policies and protections for older LGBT adults. And I'm talking here specifically about the baby boomer generation. So in this slide, you'll see a schematic from the Public Health Agency of Canada. And so for those of you who are not familiar with key LGBTQ2 policy developments in Canada, this, I think, is important, and you'll note that it starts in 1969 with the decriminalization of same-sex sexual activity. But just take a look at, what has happened in terms of the ebb and flow over time. And, you'll see that, for example, in 2017, Prime Minister Justin Trudeau apologized to LGBTQ Canadians and passed Bill C-16, adding gender expression and gender identity to the Canadian Human Rights Code. And this is a really important watershed moment, which also created the opportunity for the Government of Canada to actually take stock of what we are doing as a nation around the health and well-being of LGBTQ folks from coast to coast to coast. And so some of you may be familiar with some of the the actions that have come out of that, including the Purge Fund. And I just want to put a pin in this point, which is that following the 2017 apology by the Prime Minister, this was a class action suit actually brought against the federal government for the purging of civil servants, military personnel, and the RCMP. So it didn't come out of, I'm going to say, it didn't come out of, I would say it, from a happy place. It actually came from many decades of, actually 40 years of purging LGBTQ folks from, as I said, civil service, the RCMP, and the military. And that's a small subset of the Canadian population, but I think an important indicator that although we have seen rights enshrined in human rights Act in Canada over time, we need to be ever vigilant to make sure that we don't see a reversal in how those hard-fought rights move forward and inform policies. And I'm thinking particularly of things such as anti-discrimination policy in housing. So let's shift gears just for a moment and talk a little bit about LGBT older adults and health and social inequities. So we know that despite these various advances, some of which were illustrated on the slide I just showed you, we know that there are still a variety of forms of discrimination, whether it's hate crimes, which Chris has already mentioned. We need to know that the application of these federally enshrined rights and freedoms actually trickle down to the provinces and to how municipalities do the work that they do. So there are a variety of existing and pressing knowledge gaps that have important implications, I would argue, for housing policies and protections for older LGBTQ folks. So some of you may note that this groundbreaking study that came out of the House of Commons Standing Committee on Health really put together a series of recommendations on actions that the Canadian government and other folks, including the provinces and territories, as well as municipalities, should be working on. And I would have to just stress that what's in that document is incredibly important, and the recommendations are incredibly important. However, it is a reflection of who was part of that consultation process. So I would say it's not enough to do a one-off consultation, but rather we need to think about embedding normative data collection processes in how we determine whether we're meeting the mark over time, if we're having reversals in the application of particular policies or protections under the law, and make sure that we don't just sort of say we can tick that box because we've done that one time and we're good. So it's important to note that there are a variety of intersecting determinants of health. You can see in the upper right-hand corner, there's another schematic here that the Government of Canada uses, which is around intersectionality, and to understand that a person's sexual orientation or gender expression also meets with other axes of overlapping potential sources of oppression. And so we need to think about how the policies that we put in place or the protections we put in place for older LGBTQ folks in housing at the municipal level, how we take an intersectional framing of that so that we're not sort of siloing each particular part of a person's identity, recognizing that they are intersecting by nature. So this is a schematic I just wanted to share with you very briefly about sort of the socioeconomic and political context. So governance, which is the responsibility of various levels of government, can really impact on things such as social policies and public policies, as well as what we value as a society. So again, this is an important sort of driver for how we look at social economic positioning, and the ultimate outcome being the impact on equity in health and well-being. And again, I'm thinking about how well these systems that you can see illustrated in this schematic are actually capturing the needs of LGBT older populations. And I would argue that they're largely missing. And so in my policy analysis work, you can see lots of policies out there with goodwill in mind, but they don't actually articulate the needs or specifically populations such as older LGBTQ folks. I just wanted to again note that we've done a variety of pieces of work outside of the Canadian context. And why we did that was to sort of look at the fact that the EU or other OECD country contexts, I would argue, are much further ahead than Canada is in terms of understanding how housing could be, for example, a portable benefit, in understanding how health interventions or programs can actually be embedded in housing or housing facilities or housing services, and to address the needs of older LGBT folks in terms of aging in place. And aging in place has been used naturally occurring retirement communities, aging in place, community aging, and that all sounds terrific in policy statements. However, how that's actually enacted for older LGBTQ populations is really quite variable. So we found some interesting and innovative policies and programs in the work that we've done in select EU country contexts, and the hope was to bring some of that to the Canadian context and see whether or not it resonated. So out of that earlier EU work, we developed a small grant, a SSHRC Social Sciences and Humanities grant, looking specifically at this question, because what we found in our EU work was there was not a whole lot of focus in the Canadian context in addressing the knowledge gaps and meeting the housing needs of older LGBT Canadians, specifically in terms of how the work that we do can inform policy and practice. So we actually looked at existing policies and found very little that specifically spoke to the context of older LGBT populations. So we set out to systematically identify those knowledge gaps and to determine how best to develop policy relevant research to share best ideas and shape the future of housing policy in Canada. Very ambitious of us. So essentially what we did is we collected data from 3 data points, and I won't go into this in great detail, but we started out with a scoping review looking at existing housing policies and knowledge gaps within those policies to see how many of them are actually speaking to the needs of older LGBTQ populations. And spoiler alert, there was not a whole lot, I would say, that we found in the literature that was relevant to that particular demographic. We also used the findings from the scoping review to develop an online survey, which was sent out nationally to look at the experiences from the perspective of older LGBT Canadians themselves, as well as housing providers. So we had 3 online surveys, one for LGBT 55-year-olds, 55-year-old and older Canadians, as well as housing providers, and then those who sort of self-identify both as a housing provider as well as a member of the LGBT population. Very interesting data from those surveys. And then we took both the scoping review, lessons learned, the online survey data, and we hosted a series of focus groups in Halifax, Ottawa, Toronto, Winnipeg, Calgary, and Nanaimo to sort of workshop what we found and to ask people, is this what's going on with you? Is this something that resonates with you? Is this something that you can see useful in terms of informing policies in your respective jurisdictions? It's really important to note that in the scoping review, we found mostly descriptive studies. So in other words, it was a lot about, if we have a long-term care facility, here's what we should do to make it more inclusive. Here we have a seniors resident. It's not specific to LGBTQ folks, but if you were to have a senior resident, you should include the following things. So lots of descriptive work, not a lot of work focused on actual housing intervention. So in other words, trying out housing interventions for older LGBT Canadians and tracking over time what's working, what's not working, et cetera. We found very little on that. So in other words, we found very limited focus on system level solutions. So what does this mean, or what does this tell us? Again, restating what I've said earlier, this suggests that there are long-standing tensions between the realities of LGBT populations and housing needs and the inflexibility of existing policies, programs, and funding models. So in other words, more needs to be done in terms of policy and system level drivers and solutions. And we absolutely need better administrative data on LGBT populations across the life course. So no surprise that we're hearing a lot of stories about housing insecurity and precarity among the populations that we met with in our focus groups. Survey, we had about 980 completed or partially completed surveys. No big surprise that the majority of participants were from Ontario, Nova Scotia and British Columbia, the average age was 55, most identified as white, 6% as Indigenous, and the remainder as other. Just over 50% identified as gay, 30% as queer, 27% as lesbian, and we allowed people to select all that apply. And about 35% of respondents self-identified as disabled, with 80% of those self-identifying as having an invisible disability, whereas 11% reported having a visible disability. And what's interesting in the next statistic is the average income was between $20,000 and $49,000. That's not a lot of money, particularly if you're living out west in British Columbia or in Alberta for that matter. And the main source of income was from employment and 25% from public pension. In terms of types of housing that participants were living in, just under 40% were renting an apartment, 30% owned a house, 13% rent a house, 10% own a condo, 2% in co-ops, 2% in mobile home, and 1% in public housing, and 8% other. Just very, very briefly, key issues that we heard: lack of LGBT-focused options, the need to hide one's sexual orientation and/or gender identity from residents or from housing providers, fear of harassment and violence from residents or in the community in which they live, fear of being quote unquote too visible or too gay, being ostracized by non-affirming staff, lack of LGBTQ homelessness supports, loneliness and isolation. And just, you can see a couple of quotes from participants in Calgary, Winnipeg, and Nanaimo. So what can we do about these findings? So, really we need to advocate, I would argue, for a national program of housing research focused on the needs of older and younger LGBT Canadians. And what's interesting is we came up with this kind of concept, or we asked people about this concept of intergenerational justice. So in other words, we heard and saw in the EU really lovely, innovative models whereby older and younger queer folks live together in the same congregate living situation. And that sort of intergenerational justice piece that we saw in the EU, we didn't see here in Canada, but we did ask folks what they thought about that idea. And most people felt that that was an important consideration. I would argue that we need to seek additional sources of funding to move this work forward under the National Housing Strategy. This is the first time in Canada we've had a national housing strategy, and I fear that if we don't have more emphasis on older or all LGBT Canadians' housing needs, we will miss out on this opportunity. Further, we need to continue to mobilize our findings within the housing sector, co-ops, assisted living, long-term care. We need to include builders, city planners, architects, as well as municipal government and community members in these conversations. And we need to develop LGBT housing business plans and seek funding from CMHC and partner with municipal government. And then certainly you probably have your own ideas from your own work that would be really interesting to hear about today. So just reminding people that, the government of Canada is rolling out the National Housing Strategy as we speak. And I feel that this is a really important opportunity to ensure that the housing needs of vulnerable populations, specifically older LGBTQ Canadians, is paramount. And there's a couple of pieces of work from our study. And if you would like more information, there's my email address. You're welcome to reach out to me. Thank you again for your time. Thanks.
Thanks, Jackie. Appreciate all of the depth and the insight that you've been able to provide on this issue, and importantly, a call to action. I think that's what all of us are trying to emphasize, is that there are many different strategies or actions that can be taken that will help improve quantitatively and qualitatively the lives of LGBTQ2 individuals in Canada, no matter where you live in this great country of ours.